Good afternoon, everyone. My name is Erin Jones, and I'm here with the March of Dimes, and I welcome all of you today to come and support all of us in this effort to eliminate non-medical exemptions to immunizations. The March of Dimes stands today with lots of parents, advocates, and lawmakers to make this thing happen this year. So I'm going to ask a couple of our members here today to speak. We have Assemblymember Jeffrey Dinowitz with us. We have Senator Brad Hoylman. We have Senator David Carlucci. We have Assemblymember Jacobson. And who am I missing?
Sandy Galiff.
And Assemblymember Sandy Galiff. So, and we have some parents with us today and some of our advocates.
You want to go first?
Yeah, sure.
Okay.
It was originally your bill.
Good afternoon, everybody. Thank you for all being here. And I really want to thank all of the members and leaders of the March of Dimes. The work that you do on behalf of health, on behalf of children, is known throughout the planet, and you've been so effective over the years. That's why it is so important that we're standing here together, because what we want to do this year is protect children. And the legislation that we are sponsoring protects children. We want to eliminate all non-medical exemptions to the New York State vaccine requirements, because we know that that is going to be helpful in minimizing the number of cases of diseases like measles in the future. And I think we all know that measles could have devastating effects. Thankfully, in this day and age, in most cases, it's just a horrible illness that children get, and it lasts for a while. But the fact is, measles can kill. Thankfully, again, has not happened during this outbreak. Measles can have permanent effect on your vision, on your hearing. It can cause brain damage. And there is no reason in the 21st century why people should not vaccinate unless there's a valid medical reason. And there are people who shouldn't get vaccinated, people whose immune systems are compromised, little children. We saw some of them just last week. Infants, you don't get the MMR vaccine, for example, till a year. So if you have a 3-month-old baby, you sure don't want that baby exposed to measles or any other disease for that matter, because they can easily get it. And I think, as we know, measles is perhaps the most contagious disease on the planet. If somebody in this room right now is a carrier of the measles, has the measles, and then 2 hours later, 10 unvaccinated people come into this room, 9 of those people will get the measles. 2 hours later, it's 90% contagious, and there's nothing else like it. So we're fighting for the health of children. The bill was introduced a few years ago after California, our largest state in the union, eliminated non-medical exemptions for the vaccine requirements. And we simply want to replicate what they've done in California. And this year, I don't know if there are any cases of measles in California at all, but if there are only a few. But in New York, almost all the cases are from the whole country. They're in New York, and there is no reason that should happen. Unfortunately, even though in most areas we have high vaccination rates, it's not uniform throughout. So there are some places where the vaccination rates are lower. And if the vaccination rate is below a certain amount, usually below 95%, then we don't have what's known as herd or community immunity, the immunities that can protect those people who can't get vaccinated. And this year's outbreak, we're almost at about 1,000 people throughout the country who have contracted the measles, is the largest outbreak since 1992. That's a time 27 years ago. So if you're less than 27 years old, it's the largest outbreak in your entire life. And that's pretty scary. And it's not slowing down. So we're hoping that we can pass this legislation, and it's about one thing and one thing only, and that's protecting people, particularly children. Thank you.
All right. Thank you very much. Next, I would like to invite Senator Brad Hoylman to say a few words.
Thank you. Thank you so much, Erin. State Senator Brad Hoylman, representing parts of Manhattan. First, let me thank the March of Dimes. You know, growing up, I remember going to the drugstore and seeing that little sign where you put a dime in, and And my mom explaining to me what the March of Dimes was and how important it was to eradicating a vaccine-preventable condition in her lifetime, polio. And it began right here in New York State. And so we're very proud that the March of Dimes is stepping up once again and advocating for the elimination of vaccine-preventable illnesses. You know, if in fact in New York, if we don't get this measles outbreak under control, the United States is likely to join the ranks of Venezuela, Colombia, and Brazil as the only other country in the Americas where measles has not been eliminated. So we have regressed in our public health due to the fact that, let's face it, vaccines don't save lives, vaccinations save lives. It's so important that not only do we have the science that the March of Dimes and the Medical Society has supported for decades, but that we have a public health policy that makes certain that children and other young people do get their vaccinations to protect the most vulnerable and achieve that important community immunity. You know, we met, Senator Carlucci and the Assembly member and I met with a group of young people last week in New York City, many of whom have had organ transplants or are in the middle of a battle with cancer. And because of such, they can't receive vaccinations due to the fact that their immune system is so suppressed. And the question they had for us that afternoon was, why should they have to stay indoors? Why should they not be allowed to go to school? Why should they be afraid of getting on the bus? Through no fault of their own, they are unable to adhere to vaccine requirements. The question I have is, what are we going to do about that? Here we are in the waning weeks of the legislative session. We know that the statistics are alarming. 883 confirmed New York State measles cases since October 2018. That's among 981 confirmed cases in the U.S. So the New York has over 85% of U.S. measles cases, and yet we have not acted. I urge my colleagues, and I'm thankful to see the Assembly members here, let's get this sensible bill to the floor. Let's do what California has shown is the way to increase vaccinations by eliminating the religious exemption and protect the people who are most vulnerable. Protect young people who are immunosuppressed, women with cancer and who are pregnant, and others who are unable to be vaccinated. And I love this sign, healthy moms, strong babies. I think, Assembly member, we can all agree that's what it's all about. Thank you.
Yep.
Thank you very much, Senator. Next, I would like to invite Senator David Carlucci to say a few words.
Thank you. Well, good afternoon. I want to thank everyone for being here, and particularly want to thank the March of Dimes for their advocacy and standing with us today, but for their work over the last 80 years to protect babies, to protect mothers and families. And it's somewhat ironic that 80 years ago, when the vaccination for polio was being developed, much of the work was done right in Rockland County. And now here we are today with another disease that we know we can fight with vaccinations, but is now at 255 cases in Rockland County, 38 cases in Westchester County, the two counties that I represent. And so like my colleagues have said, we now have over 800 cases, confirmed cases of the measles. So it's our obligation and our responsibility to act. 19 years ago, we were talking about the eradication of the measles. Talking about all the advancements that we've made in modern medicine. And yet here we are today where the measles has spread. And like my colleagues have said, Senator Hoylman and Assemblyman Dinowitz, the children that we met with last week, those are the calls that I'm getting in my office in Rockland County, where young mothers and families are concerned for their safety, because their children have not been vaccinated yet. So they're living in fear, and we have to stop that. We know that the best thing that we can do to get more people vaccinated is to pass this legislation and to make sure that we are at herd immunity. We have to do everything we can to protect our children, to protect our families. We have a responsibility to lead, so let's do it. I want to thank my colleagues in the Assembly and the Senate that are here with us today, and I'm confident that we'll be able to get this legislation done by the end of session. So again, I want to thank the March of Dimes and my colleagues. Let's continue to work together to protect families in New York State. Thank you.
Thank you, Senator. I also would like to invite Assemblyman Jacobson to come and say a few words.
Thank you. I'm Jonathan Jacobson. I represent in the Hudson Valley, Beacon, City of Newburgh, Town of Newburgh, Marlboro, Lloyd, and the City of Poughkeepsie. And I want to thank the March of Dimes, and I particularly want to thank the sponsors for proposing this very common sense health bill. That's what it is. You know, if this was happening in another country, you would consider that country barbaric, living in caveman times. I mean, it's just incredible that this is happening, not only in New York State, but in any place in the United States of America in the 21st century. And I want to dispel the myth about this religious exemption. There's been no religious organizations that say that you can't have vaccinations. I haven't seen it. But because that is in the law now, people are using that as a claim because they're spreading fear and things they see on the internet and all kinds of things like that. And I just think that what we have to do is just pass this common sense legislation. It has a medical exemption. You don't have to say you're doing some religious observant. If you have a medical problem, you don't get the vaccination. But this is just common sense. I mean, if you had a situation where people were burning tires and polluting the air so that you couldn't do it, you couldn't just say, well, that's my religion. No, you would have to say no. When you do something that affects everyone else, there are limits. Just like you can't yell fire in a movie theater. There are limits to everything. And here is just a very common sense bill, and I think that people will get behind it. Because I don't know anybody that wants to go to a school, a supermarket, or any other public place where they'd be scared of catching the measles. So again, I want to congratulate the sponsors for acting quickly on this, and the March of Dimes for supporting us in this important effort. Thank you.
Thank you, Assemblymember. I also would like to invite Assemblymember Sandra Galiff to the podium.
Thank you very much. I have to report on a little history. I was born in Wisconsin, and my recall, I don't know about you, but I don't remember a lot of what was going on, but I do remember when I was 4, and I was out in my front yard, and this big policeman came up, I assume I wasn't too tall, and said, little girl, get inside of your house. Polio is around. Get inside of your house. And I'm thinking, you know, I don't know whether I stayed in my house forever, but that was the feeling, I mean, that I remembered that, struck such a tone. And I think about all the people that I have met over my life that have had polio, that it didn't come out right away that they had polio, that maybe 20 years down the line, 30 years down the line, they had disabilities because of polio. And, you know, because of that history, we don't want to repeat it again. We don't know. I mean, there's some things that Assemblyman Dinowitz talked about that can occur, but there might be some other things because we eradicated measles, so we don't really know maybe all the things that could occur 10 years from now, 15 years from now, when somebody has had measles and it's residual in the body. So let's not do it, and I think always on most of these issues, the people that don't want something are the ones that call our office. The people that don't want something are usually the ones up here. It's great you're here because we don't always hear from the, I would say, 80 to 90% of the people that want us to pass this bill. So let's pass the bill.
Next, I would like to ask Cerise Marotta to come up and speak. She is a parent who has her own story to tell.
Thank you. Hello, everyone. My name is Cerise Marotta, and I am a representation of what happens when we don't have herd immunity. My healthy 5-year-old son passed away from an infectious disease, specifically flu, in 2009. I'm here not only to share his story, his name is Joseph, this is his picture here, but I also represent a lot of other families who have lost children and loved ones to vaccine-preventable diseases. I think most people out there like to think that this doesn't happen. We can talk about the data, we can talk about the statistics, but when there's a face in front of you sharing a story, all of a sudden it becomes real. I wish this didn't happen. I wish children did not die from vaccine-preventable diseases. Sadly, it does happen each and every year. So vaccination, the way I like to think of it, is not just an individual choice, it's a societal one. When we make that choice not to vaccinate, not only are we not helping to protect ourselves as individuals and our families, but we're also putting others at risk. If we live in communities, we go to schools, we send our children to schools, we're out in the community, we could potentially transmit something to someone who may not fare as well. They may get that disease, they may recover, but they may not. They may become hospitalized. They may even lose their life. Speaking about community immunity, that is exactly what we're trying to achieve here. We're trying to protect public health. I think we all know when we look at the science, vaccines are safe, vaccines are effective, vaccines save lives. My son lost his life to a vaccine-preventable disease. Someone was my Joseph's patient zero. I don't know who that was. I will never know who it was. But I can tell you, standing here today, my life will never be the same. I will always have an empty chair at my dinner table. I will always wonder what he would look like now, where he would be going to school, what he would be doing. I don't have that chance. What I want other families to know is they have that chance to choose to vaccinate, to choose not only to protect their family, their children, but to help protect public health at large. I think it's time we all recognize that we all play a role in keeping our communities healthy through vaccination. Thank you.
Thank you, Cerise. I now would like to ask Jennifer Daigle to come up, and she's also another parent who'd like to tell her story.
Thank you. My name is Jennifer Daigle. I'm from an organization called Speaking for Moms and Babies. And I'm standing up here today because I am the parent of a premature baby, a medically fragile baby. She's now 7 years old. But when she was born severely premature at 23 weeks gestation back in 2012. And her 4 months in the NICU were excruciating for her whole family, for us. She almost lost her life on several occasions. And everybody worked so hard to keep her alive and so we could bring her home with us. Well, after we brought her home after 4 months, we were fairly certain that we would be able to keep her safe from very preventable diseases. And that's not the case for a lot of the babies in the NICU today. I also run a parent mentor program at Maria Freire Children's Hospital. And I've gotten asked by parents there, what will happen when we bring my daughter home with this measles outbreak? What are we going to do with my son? And they really essentially are being told they have to live in a bubble because you can't vaccinate babies for at least 1 year, possibly 6 months for measles, unless there's some circumstances there. And as a parent of a medically fragile child, it is so upsetting to think that your child can get out there and contract something that could be preventable, and they can lose their life. She almost lost her life twice to the rhinovirus and something called a human metapneumovirus, which would be just a common cold to any average person. And the person that gave it to her, like was just mentioned before, we will never know. And she was back in the hospital for 2 weeks. And the really scary thing about measles is that it couldn't be a week, 2, maybe 3 weeks before you're showing really signs and symptoms to even know that you're sick. And these poor babies that aren't even able to get vaccinated, there is no choice for them. They have no choice, their parents have no choice, and they're forced to be in the world. And even if you try your best to put them in a bubble, There are still siblings that are coming and going from houses. You still have to go to doctor's appointments, camps and schools, and there's so many opportunities for these babies that are medically fragile to contract measles or any other virus. And the fact that it is preventable and that we almost had it completely gone from our country and now it's coming back is sad. And just on a side note, I'm also a high school science teacher, and in my biology class, we always talk about the success of the polio vaccine and how wonderful that was and how we're benefiting in our country every day. And it's really sad to see that that's changing with the measles vaccine and that there's so many vulnerable populations that are now susceptible to this very preventable disease. So I ask, as a mother of a premature baby, from all the families of medically complicated babies, that you please get this bill to the floor and pass it. Thank you.
Okay, I'd like to call up Dr. Gus Burkhead, who is representing the New York State Public Health Association.
Thanks very much. I am Gus Burkhead, representing the New York State Public Health Association. I'm also a professor at the University at Albany School of Public Health, and in my prior life was a deputy commissioner for public health at the state health department here. Back in 1989 to 91, I was the state immunization program director during the last measles outbreak that we had, 1989 through 1991, 3 years. During that outbreak, we had over 5,000 cases and over 20 deaths in New York, mostly in New York City, but also in the rest of the state. So I spent a good part of my life during those days down in New York City trying to deal with a very large outbreak. We made some policy changes based on that outbreak. For example, that's when a second dose of measles was recommended because one dose wasn't cutting it. We also formed the Vaccines for Children program, which provided vaccines to healthcare providers serving the poor and indigent who had not been really fully vaccinated. And as a result of those and other measures, by the year 2000, we had actually achieved measles eradication in New York, which means that when a case comes from overseas, as inevitably happens from time to time, that case might cause a couple of additional cases, but then would die out because, as has been discussed, our level of community immunity was high enough that the virus couldn't find unvaccinated people to infect, and the outbreak would die out. Unfortunately, in the last couple of years, and based on that, we declared measles eradicated in the United States, as you've heard. But unfortunately, in the last couple of years, we have seen a resurgence of transmission of measles in New York. This outbreak started last September. So we've had 10 to 11 months now, 10 months of continuous measles transmission occurring in an under-vaccinated community based on religious exemption from school requirements. But this is not the only community in New York with low levels. I think as the map shows, we have many school districts with high enough levels of under-vaccinated kids, unvaccinated kids, that it's just a matter of time before measles gets introduced there and we have another outbreak occurring. So as has been mentioned, we're at risk for losing our status in the United States as having measles eradicated, which I think would be embarrassing to say the least, but really horrifying that we are not able in the 21st century to keep our levels of vaccination high enough to prevent this completely preventable disease. So this is happening basically because of the ability for non-medical exemptions to occur for kids going to school. And basically, that system worked for a while when rates of non-medical exemptions was very low, but now it's reached the point where that level is no longer protective, and we are seeing these ongoing transmission of measles cases occurring. So that system has failed. It's failed public health. It's failed the health of our children and of the rest of us in the state, and it's time for it to be removed. So the State Public Health Association supports this along with a whole other group of public health advocates in the state, including the local health directors. I'll just end on a personal note. I have a friend from way back in grade school who developed leukemia last year and needed a bone marrow transplant. And when you have a bone marrow transplant, you basically hit the reset button on your immune system, and he will need to be revaccinated again for all the childhood diseases, including measles, when his cell levels come up. And he jokingly said, well, I guess I'm not going to go to New York City anytime soon. because of the measles. And I said, you know, that's not a joke. You're not. And so we have, as has been mentioned, kids and adults too in the population who can't be vaccinated and who are at risk of severe outcome with measles. And so we need to think and protect them. So it's our duty really as a society to take all the steps we can in 2019 to protect the most vulnerable among us. Thank you.
Thank you, Doctor. And finally, I'd like to ask Julie O'Hare to come up, who is a nurse, and she's representing the Nurse Family Partnership.
Good afternoon. Thank you for your time. As a registered nurse home visitor with Nurse Family Partnership in Monroe County, Rochester, New York, part of our mandate as a team is to meet and partner with our families, pregnant women, young mothers, to help them achieve their best health and best wellness possible. And we do that through conversations and education with mutual respect. A lot of what we do as nurse home visitors is help our clients figure out where is the reliable information. What do they need to know? Who can they speak to? What will help them make a choice for themselves and their babies to optimize their health? Evidence through all of the science has shown the benefit of immunizations. You've heard all the people here with their experience, personal, professional. And our clients respond, and they make choices to vaccinate their children. I think that's a powerful piece of information to know, and it really gives me hope because I know that they're going to be able to apply that thoughtful consideration about choices to other health decisions that they make for the future of themselves and their babies. That's really important to us in Nurse Family Partnership, maternal and children's health. Thank you.
So I think the message we were trying to get across today is that vaccine preventable diseases is a collective responsibility. And I think we've shown you with some of the people that spoke today that we're all working together to make this happen. If we all come together in support of immunization, we can eradicate many diseases like polio and including measles. Our children deserve no less. So I thank everybody who came today. I thank all of our people that came up to speak. One group that did not get to speak, but I do want to mention, is our Nurses Association, who's here with us today as well. This is really a collective thing. We all really want to work hard to get this done for all of our families and babies and moms here in New York. Do you want to say any closing remarks? Put you on the spot.
I don't want to get myself in trouble or anything.
Okay.
Next month is the 50th anniversary of the first time people landed on the moon. I remember that from when I was a kid. It was like one of the most exciting things in my life to watch people actually walking on the moon. 50 years ago next month. Do you know that there are people today who don't believe it happened? They don't believe we landed on the moon. There are people who don't believe, people who believe 9/11 was an inside job and not a terrorist attack. There are conspiracy theorists out there. There are also people who don't believe that climate change is a reality and that it's caused by people. There are a lot of people who believe what they believe, and very often you can't change their minds, but science is science. I believe in science. The science on vaccines is clear. It's not ambiguous. It's not up for debate at this point. There was one study 20 some odd years ago in the late 90s that was debunked. The doctor was, he lost his medical license. He was from UK. And based on that study, many people came to believe through the wonders of the internet, where some people seem to get their medical advice, that vaccinations are bad. Every other study shows that vaccines work. Millions and millions of lives have been saved. I remember I used to have this mark on one of my arms. I don't remember which arm anymore. I think it was from the smallpox vaccine that I got when I was a kid. Is that right? Smallpox? There is no such thing as smallpox anymore. People aren't dying from smallpox. People don't get polio anymore. People aren't being, disfigured or crippled from polio. I remember when I was a kid, the Salk vaccine. It was a miracle. That was a miracle, just like landing on the moon was a miracle of science. And that's what this is. We're talking about science, we're talking about health. I believe in science. I believe we have to protect our children. So I hope that before the end of the legislative session, this legislation will become a law, and I hope that it will save lives and will keep kids healthy.